Hello, my name is Jacquelyn Reilly, and I'm a graduate student of special education at SUNY Plattsburgh. Today, I'm going to be discussing positive behavioral interventions and supports, or PBIS, versus specially designed instruction for students with emotional and behavioral disorders, or EBD, under IDEA. To start, let's discuss both PBIS and EBD under IDEA. PBS defines itself as an evidence-based three-tiered framework for improving and integrating all of the data, systems, and practices affecting student outcomes every day. It is a way to support everyone, especially students with disabilities, to create the kinds of schools where all students are successful. As a field, educators are far better at describing and documenting small-scale success rather than producing broad and sustained systems change. PBIS is focused on entire schools and districts, and when implemented well, students achieve improved social and academic outcomes, schools experience reduced exclusionary discipline practices, and school personnel feel more effective. PBIS's three-tier approach addresses all students in a learning community. Tier 1 establishes the foundation for delivering regular, proactive support and preventing unwanted behaviors. Tier 1 emphasizes pro-social skills and expectations by teaching and acknowledging appropriate student behavior. Tier 2 is for students who are not successful with Tier 1 supports alone. This normally accounts for 10 to 15% of students in a learning community. Tier 2 supports often involve group interventions with 10 or more students participating. The support at this level is more focused than Tier 1 and less intensive than Tier 3. Tier 2 foundational systems include an intervention team with a coordinator, behavioral expertise, fidelity and outcomes data are collected, a screening process to identify students needing Tier 2 support, and access to training and technical assistance. Tier 2 practices include increased instruction and practice with self-regulation and social skills, increased adult supervision, increased opportunities for positive reinforcement, increased pre-corrections, increased focus on possible function of problem behaviors, and increased access to academic supports. At most schools, 1 to 5% of students need the intensive individualized preventions of Tier 3 support. Tier 3 strategies work for students with developmental disabilities, autism, emotional and behavioral disorders, and students with no diagnostic label at all. Tier 3 foundational systems include a multidisciplinary team, behavior support expertise, formal fidelity and outcome data are collected. Tier 3 practices include function-based assessments, wraparound supports, and cultural and contextual fit. Moving on to the IDEA classification of EBD. The Individuals with Disabilities Education Act is a law that makes available a free, appropriate public education to eligible children with disabilities throughout the nation and ensures special education and relative services to those children. IDEA mandates that an individualized program be delivered to every infant, toddler, and student who is identified as having a disability and needs special education. The purposes of these individualized programs are to ensure that each of these individuals receives a free, appropriate public education, is provided an education in the least restrictive environment, is specific to the student, and is provided services within the expectation of outstanding results. For a student to be classified as EBD under IDEA, the following criteria must be followed. Emotional disturbance means a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. An inability to learn that cannot be explained by intellectual, sensory, or health factors. an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fears associated with personal or school problems. An emotional disturbance includes schizophrenia. The term does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance. Using the criteria for IDEA, about 2% of the student population would meet the criteria for EBD. The Best Practices Guide to Intervention from Seattle University in 2005 states that students included within this 2% are primarily those students who have trouble following directions, are oppositional, and who become aggressive toward others. Within the special education system, about 1% of the total student population is identified as having an emotional and/or behavioral disorder and is in need of special services. The formation of an individualized program can be organized into 7 steps, beginning with pre-referral and ending with evaluation and reviews of a student's program. These steps include pre-referral, referral, identification, eligibility, development of the IEP, implementation of the IEP, and evaluation and reviews. Now that we have outlined these 2 different support systems, let's compare them. We will start with some main similarities. Both tiers 2 and 3 of PBIS and EBD under IDEA are intended to support the emotional and behavioral needs of students in a learning community. Both are intended to improve student outcomes, both behaviorally and, by virtue of the support system, academically. Both are intended for a small percentage of students in the learning community, and both use data to select, monitor, and evaluate outcomes, practices, and systems. Next, let's highlight some of the main differences. IDEA protections and supports are only intended for students with a disability. IDEA protections are backed by law. Once a student meets the criteria for classification under IDEA, their IEP is a legally binding document. PBIS is a school-wide approach intended to support the entire learning community, not just one group. Finally, IDEA is a nationwide support program for students with disabilities that is mandated in all public schools. As of 2018, PBIS systems were implemented in just under 30,000 schools. I hope this helped you better understand both PBIS and IDEA supports, as well as the similarities and differences between the 2. In just a few moments, you will see a list of references used in the making of this presentation. Thank you for your time.